Hi everyone, I'm Kim Huelin. I'm a project support officer at Health Innovation West of England, where I support the Southwest Learning Disability Collaborative. But today I am going to be speaking from a personal perspective as Becky's sister. I wanted to share a glimpse into Becky's world and what healthcare means for her and our family. So meet Becky. Becky is my older sister. She has a severe learning disability and autism, and she needs support with most aspects of daily life. Her world is built around her routine and the small, simple things that she enjoys. So, as a family, we work hard to try and weave these things into her day to day life. So, I thought I'd give you a little glimpse into Becky's world just so you can have a better understanding of who she is and what matters to her, really. So, as you can see, Becky's week is very structured, just as she likes it. But I'll pick out a few highlights from this schedule. So we've got cooking, singing, listening to music, playing games at the day centre that she goes to a few days a week. We've got a cinema night and a cinema afternoon at home in there where she watches Sonic and Paddington with my parents. But the activity or event that is probably Becky's biggest joy and really what her world revolves around is our family shows, as she likes to call them. And these are basically little gigs that she puts on with the help of the family for all of our siblings' birthdays. And we play songs from whatever band or artist she's obsessed with at the time. So that's why she's dressed up like Elton John in this photo. We did an Elton John show. And yeah, because we have a big family, these shows end up happening pretty often. So she's always planning, preparing, and talking about her shows. So these routines and activities, they shape her world and they give her structure, comfort, and bring her a lot of happiness. So for Becky, health isn't something that she actively thinks about. If it sits outside that structured routine, it's unlikely that it's something that phases her. And so, because of that, my mum, as her primary carer, manages all of her healthcare from arranging appointments, interpreting guidance, and making decisions on Becky's behalf. This responsibility, it can be complex and stressful because every decision has to balance Becky's comfort, her dignity, and well-being. So for our family, health is definitely a shared responsibility and not something that Becky can navigate alone. So cervical screening is an example of how challenging healthcare decisions can be. Becky receives routine invitations, but really no one has ever sat down with us or my mum as her primary carer to talk about whether this is something that she should have given her circumstances. Um, as a family, we know Becky's world. We know what she understands and what she doesn't. And so we know that this procedure would be deeply confusing and potentially distressing for her. And what makes it harder is the inconsistent advice out there. So one person will say one thing, someone else says another, and we are left trying to piece together what the safest and kindest option actually is. And that responsibility does ultimately sit with my mum as her primary carer. She carries that emotional weight of having to make these decisions, what's always trying to do what's right for Becky. So I think our experience really shows how families can end up navigating quite complex healthcare choices on their own, even when everyone involved is genuinely wanting the best outcome. So, why does this matter? I think that Becky's experience shows that when we talk about improving screening uptake for people with a learning disability, It's obviously not just about sending reminders, it's about recognizing that healthcare looks and feels very different depending on the person. Services can only really work when they understand the individual's world and meets them where they are. When that doesn't happen, things that are more straightforward, perhaps for most people, can become distressing or even traumatic. And family and carers, people like my mum, they often carry a huge emotional burden trying to interpret this mixed advice and again, make the safest, kindest decisions. So ultimately, accessible and compassionate services need to support both the individual and the people who care for them, because that's what really makes a difference. So thank you very much. That was Becky's story, her experience, her world. I really appreciate you listening.